Hey everybody, my name is Armando Falcone and welcome to my very brand new YouTube channel here, Armando on Mounjaro. And this channel is really going to follow my full journey of being diagnosed newly as a type 2 diabetic and treating this with Mounjaro, a once a week injectable medication. Now, I'm currently on TikTok and Instagram, and for the past 3 months, I've really been active on TikTok. But I figured, I should really begin my YouTube journey now as well, and so hence why I have created this channel. Now, my diabetes journey began in November, right before Thanksgiving. I went for a typical checkup with my primary care physician and then was diagnosed after, doing the blood and the lab work as a type 2 diabetic. And at the time, my A1C was 7.4. And my doctor had really just explained to me that, my A1C was moderate enough. It could more than likely, I could control my type 2 diabetes with just nutrition and increased exercise alone. But I also do have high blood pressure, and my labs also showed fatty liver disease and a high BMI. And I'd previously spoken with my doctor about perhaps a little bit of extra help in terms of weight loss. So with my BMI as a factor, my high blood pressure as a factor, fatty liver disease, and type 2 diabetes all working together, my doctor suggested, maybe we should go ahead and put you on a medication because there are some of these newer injectable hormonal medications that can really help tackle all of the different medical conditions that I have. And so I thought, what? I really owe it to myself to take care of my health. It's not something I'd really done over the years. So why not give it a try? It'll help with my A1C. It'll help with my weight and lowering my BMI. And it'll help, obviously, with my blood pressure as my weight comes down and reducing the fatty liver disease. So I originally began on Ozempic in December. Ozempic really gave me terrible heartburn. It would just flare up like a wildfire. And so I was only on Ozempic for the month of December. 1 month on a medication, I wasn't really expecting to see any results, and I didn't really have any results. Now, when it came time to refill for January, my pharmacy told me that the medication was no longer covered. And so I was like, what do you mean it's not covered? I've been on it for a month already, and I have the type 2 diabetes diagnosis. Well, ended up calling my insurance, and my insurance verified that, with the brand new calendar year of 2024, they had put Ozempic on their, no longer approved medication list. It was no longer in their approved formulary list. So I said, okay, well, what other medications do you cover? And for injectable incretin medications, what they covered were Mounjaro or Trulicity. Now, Trulicity, I know, is a little bit of a more older school GLP1 medication, doesn't work as effective as Mounjaro. So I said, well, let's do Mounjaro then. Now, that took a little bit of back and forth between me, my primary care physician, my insurance, and my pharmacy in January. So actually for January, I was not taking any medication as all of this was really being figured out. So my Mounjaro journey started really February 9th was my starting date. And, it's been great since then. So, January or February, I was on the 2.5 milligram dosage, which is the starting dosage. The 2.5 dosage is not meant to, it's not meant to be a therapeutic amount of the medication. It's just meant to get your body used to the medication so you kind of get a sampling of how well you will tolerate the medication and what type of side effects you might or might not experience. Now, during that first month of 2.5 milligram Mounjaro, I lost 13 pounds on the 2.5 dosage, and for those of you watching, don't expect those good of results on 2.5. Everybody is different, and I was a little bit more of a what we call a super responder on that beginning introductory dose. Then I moved up to the 5 milligram dosage, and for those of you that are just kind of new into the GLP1 community, the 5 milligram dosage is kind of known as like the funky 5 because it treats some people really well. Some people get insane results on the 5 milligram dosage in terms of blood glucose control and weight loss. But many of us almost see no progress with the 5 milligram dosage. And I was kind of one of those. I didn't have blood work done on the 5 milligram dosage, so I don't know for sure, what it did for my blood glucose levels. But in terms of droppage on the scale, I just lost 5 pounds on the 5 milligram dosage, which I was on for 1 month. So then following kind of the dosage, my doctor said, we still want to work on your A1C a bit more, so let's go up to the 7.5 milligram dosage. So all of the this month of April, this is the last day of April that I'm filming this video, I've been on the 7.5 milligram dosage, and today is Tuesday, April 30th, and I just started my second box of 7.5 milligram today. So I did do a weigh-in this morning, and so it looks like I lost another 5 pounds on my first month of 7.5 milligrams. So altogether, from when I was diagnosed as type 2 diabetic to today, I'm down approximately 26 pounds, which is amazing. It would have taken me, probably years or, close to a year at least to lose that amount of weight all on my own. So this medication really has been life-changing for me. My A1C as of 2 weeks ago is now down to a 5.6. So in just 3 months, I've gone from, a diabetic level of A1C to pre-diabetic to a normal A1C level, equivalent to somebody that doesn't have diabetes, okay? My blood pressure has also improved drastically with the weight loss. And so at my appointment 2 weeks ago with my doctor, my checkup, I was actually able to reduce my blood pressure medication from 20 milligrams of lisinopril all the way down to 10 milligrams of lisinopril because I was reviewing my blood pressure readings with my doctor, and a few of them were just kind of knocking on the low doorstep. So he said, you know what, we can go ahead and reduce your lisinopril dosage because you don't need that larger of a dosage anymore. So that's been great. And then also with my lab work during my 2 weeks ago appointment, my fatty liver disease is drastically reduced. My liver function is improving very, very nicely. So today starts week 13 for me. This will be my second month on 7.5 milligrams. And then I believe next month I'll be going up to the 10 milligram dosage. The reason for that is my doctor and I discussed it, and I'm a big advocate for staying on the lowest dose possible that's effective for you. And that's going to depend, of course, if you're a type 2 diabetic or if you're just focused on weight loss. But I'm focused on both. But my doctor suggested that because I do have that fatty liver disease, let's go up to that 10 milligram dosage. Let's quickly eliminate that fatty liver disease, and then we can go back down to 7.5, because there is the clinical data that Eli Lilly conducted that does show, treatment with tirzepatide or Mounjaro drastically reduces, if not completely eliminates, fatty liver disease in patients on the 10 milligram, 12.5, and 15 milligram dosages of Mounjaro. Usually by week 52, anybody on those dosages, close to 65 to 70% of patients had completely eliminated their fatty liver disease by week 52 on tirzepatide. So I'm only on week 13, but already my fatty liver disease is almost completely gone. So that's just a really quick introduction to me, my Mounjaro journey, my type 2 diabetes journey. Stay tuned to my channel. I'm going to be posting every week updates on how I'm doing, keeping you up to date on Mounjaro and answering all the questions that you might have. So please comment below. Let me know your type 2 diabetes, type 1 diabetes, or GLP1, Mounjaro, Ozempic journey. And let me know if you have any questions, and I'll be happy to answer those. And say hello to my dog Apollo down there. He's hanging out with me today in my office. So I'll catch up with you in the next video, everybody. This has been Armando on Mounjaro. Have a good one.